The thing that excites me most about the Fenway Institute is that we get to deal in the future. We get to talk about what is the perfect future when it comes to LGBT communities, when it comes to HIV, and then we get to be a part of creating that future.
So we have a lot of providers here who are trying to provide the best possible care for the LGBTQ patients, but they need the data to be able to inform that care. And so that's really the value of the Fenway Institute in being able to do that, to collect that data. But then also it goes beyond just a collection of data to be able to provide policy recommendations, to be able to go out and step into other health centers and train them and say, we've done this successfully, this is how we've done it, this is how you can do it too.
It's really exciting at this time right now because to be a part of Fenway and to be a part of an organization that stands behind looking at the whole spectrum from LGBT youth all the way up to LGBT elders. These folks have flown under the radar screen for most of their lives. They've just not wanted to draw attention to themselves, but it gets down to the point where they're aging and they become frail and they need someone to come into their home. And the fear is that that whole level of discrimination is going to come back again, that someone's going to judge them or not treat them well because they're gay, lesbian, bisexual, or transgender. And we're developing programs here, models of programs in Massachusetts that we can expand out to other states.
What's exciting is when it comes to things like HIV, we really have the tools to what they call get to zero. We have the tools. We're to a place where we know how to end the epidemic. It's not about if, it's about when. If we can get to a place where we're breaking down the barriers of people getting medication, then that's when we're going to win this fight.
Hearing stories about people through our work that they're being outright denied care or, facing discrimination in care. Those are some of the realities that we still deal with, is people aren't able to access the care that they need because of their gender identity.
In October of 2015, we held the first annual transgender health conference called Advancing Excellence in Transgender Healthcare. It was really incredible. We had a packed house. I think transgender health is an area that we, the Fenway community, has always known that it's an issue that is important. And I think that the larger healthcare community now is seeing it as a topic where training is needed. And so we're there to fill in that training void, and that's exciting. And so we're trying to kind of be both responsive and anticipate a little bit what is coming and maybe drive a little bit what's coming.
Now that the government is mandating the collection of sexual orientation data, this is so critical to us, especially in the work around LGBT older adults, because if you are not counted, you don't count.
Now, with that data becomes the ability to provide recommendations for care, to create services. Without that data, you can't do that.
It creates a situation where no LGBTQ person can be ignored in the healthcare system. And before that, it was not the case.
Fenway was really at the forefront of this and led the way to this rule coming out.
It's all about equality, right? And when you create a system where somebody feels comfortable in an environment to talk about all of who they are, then you get a situation where they also are comfortable to talk about their health care.